You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
Great. All right, my name is Genevieve Marshall. I'm a PGY3 at Zucker School of Medicine at Hofstra Northwell. I also have my co-resident, Colin Chen, here with me today. He's also a PGY3, and one of our chiefs, Amy Park, should also be signed on to help answer some questions that any of you may have in the chat, and she can chime in with her typed answers or verbally, okay? So we'll start just by saying welcome to Long Island. We have a great community here, very close to New York City, but not in New York City. We have tons of beaches, wonderful vineyards that you can attend, beer crafters, great dining opportunities, very diverse cultures. We have tons of professional sports, charming towns to explore or to live in. And of course, we have the Grandmaster Billy Joel. We are close to New York City. We have a rotation there for EMG, but we are not too close. So you do get that suburban feel where you live. And we call it the ultimate staycation. There's plenty of opportunities to relax and enjoy life while you're living here. We also all find that it's one of the best places to practice medicine. A lot of the New York residents and physicians will tell you that. And I'm going to turn it over to Colin to talk a little bit more about the residency itself.
Hey guys, my name is Colin. I'm a PGY3. Just have a virtual background because my fiance asked me to give some privacy. And regarding the residency program, it's a 3-year ACGME credit program. There's 4 residents per class year, so a total of 12 residents. As Jen mentioned, we are located at multiple sites. Though generally we stay at one location for inpatient rehab, and then for outpatient, there are several sites we rotate through depending on what subspecialty or rotation we're on. We are heavily involved in academia in the national level, AAPM and our AAP. We had our residents have research and scholarly projects and we presented there before. A couple of us are working on some case reports and research projects right now that we're hoping to be able to present or publish soon. There are resident-run journal clubs that we have every month, depending on what specialty block we're for didactics we're going through. We have medical students from the Hofstra Zucker School of Medicine that rotate with us, as well as medical students from nearby DO school, NYIT, and Touro College that also rotate with us. I think before COVID, there were more like people from other schools, from other states rotating, but with COVID, it's a bit more difficult. But I think it's hopefully, eventually we'll be opening up for more students from other schools. We had a way elective time. I think that's coming back as the cases were improving. But, with the Delta variant, that's hard to say again. We do have a very good balance of inpatient and outpatient opportunities each year. I think for all 12 years, we do a total, I'm sorry, not all 12 years. We do a total of 12 months for all 3 years of our residency. So that's going to be, I'll talk more about that in a little bit. Regarding professional mentorship, we have our attendings from, I think, almost all subspecialty, if not all subspecialty related in rehab medicine. And we also have a brain injury fellowship that I'll talk more about later.
Okay, and just to let you know about some of our great physicians who are leaders in our program, we are led by Dr. Stein. He is our PM&R department chair for all of Northwell Health. He is a specialist in spinal cord injury medicine. He is the immediate past president of the AAP. He encourages us also to have national involvement in organizations. He is also, we also have Dr. Landry. He is he is our program director for the past couple of years. He's a specialist in pediatric rehab. He is Mayo trained. The wonderful Dr. Maltzer, she's the vice chair for PM&R for Northwell Health, and she is the chairwoman of Glen Cove Hospital Rehab. She gets involved very hands-on as well, helps us with our admissions. At times we rotate with her. She fills in for various physicians when they're on vacation. So very involved chair of the department and vice chair. And then we have Dr. Rosanna Zabini is the Brain Injury Fellowship Director, as well as the chairperson of our South Shore University Hospital PM&R department.
So like I was saying, we have a lot of attendings that are trained in different fields of rehab medicine. Dr. Schatzer, who was our former program director, he's SCI trained, spasticity rehab consult. Dr. Aresti, a wizard in PNO. He also does general outpatient PM&R and musculoskeletal and spasticity management. For those of us, or those of you guys interested in pain medicine, we have Dr. Qureshi. She's very hands-on in terms of what you get to do. Dr. Sarah Khan, she's an inpatient TBI attending. And so if you're interested in TBI fellowship, that's someone to learn a lot from. Dr. John, she's one of my favorite attendings as well. She's in charge of, she's in one of the attendings at Glen Cove. Dr. Schindel, though she won't be with us soon. She's moving to Pennsylvania. We have Dr. Okada, sports and spines trained, Dr. Golden, interventional pain, Dr. Lefkowitz, also pain and EMG, Dr. Alpert, who's palliative care trained, but also well-versed in cancer rehab, and she's also one of our rehab consult attendings. Dr. Martone, he's cancer rehab trained and also does OMT practice. Dr. Amy West, sports medicine, and also does interventional MSK ultrasound. Dr. Protorodecki, also EMG, and there's a lot more other attendings that we weren't able to fit in this slide.
And as Colin was saying, our inpatient rotations, we have a TBI unit. We have another unit that has been used for post-COVID patients at times. We have a lot of complex medical patients and neuro rehab as well. That's done at Glen Cove Hospital. It's not a standalone rehab hospital, but 76 of the beds there are for rehab. It's a community hospital, so it has that kind of community feel. We also do our consults at North Shore University Hospital, which is a level 1 trauma center, Long Island Jewish Hospital, South Shore University Hospital is another location for consults, also has a lot of trauma patients that we see there. We also have I think it's like the New York area is one of the only standalone children's hospitals, Cohen's Children's, where you do your consults with Dr. Landry, our program director. And then we have numerous outpatient clinics where we're with those attendings that Colin just talked about. And I'll just take this slide, Colin. This just shows where our main location sites are. As you can see, if you know Long Island, the star all the way to the left, that's Manhattan. That's where EMGs are done with Dr. Protorodecki. The star towards the top, that's Glen Cove Hospital, South Shore University Hospital, which is our furthest east, somewhat into Suffolk County. We have one outpatient site that's on the border of Suffolk County as well. But nothing from the main cluster that you see there, nothing is more than about half an hour away by car or by train.
Okay, so as Jen mentioned, Glen Cove Hospital is where we do inpatient rehab. It's located on the North Shore of Long Island. It's about maybe half an hour away from North Shore Hospital and our main outpatient clinic. There's total of 76 beds for the rehab service specifically. We have a brain injury unit, a general rehab unit. We have a post-COVID unit that now has, well, since the cases had gone down initially was being transitioned back to a general rehab unit. Again, all our residents and attending, we work closely with each other and with the therapists, social workers. We know each other on a first name basis for a lot of the therapists and social workers. And as you progress as in your PGY 3-4 years, you have the opportunity to lead the multidisciplinary rounds, and also, of course, mentoring the medical students that rotate with us.
Yeah, so we're very lucky. We have the Hofstra gives their third year students an opportunity to rotate in PM&R, and then they often come back once they decide that they want to do our wonderful specialty. They'll come back as fourth years. Just to kind of an overview of what our rotations are like. We have inpatient rehab spread out through the course of second through third and fourth year, but it's primarily 6 months of inpatient rehab during the second year, then 4 months in the third year, and then 2 months of inpatient rehab in the second year. That covers all the specialties. We break them up so that you have TBI, spinal cord, and complex medical throughout. During your second year, there's a month of outpatient MSK where you get a lot of hands-on ultrasound guided injections, some exposure to EMG as well. Outpatient neuro, where you're doing a lot of spasticity management, working with Dr. Aresti, who Colin mentioned, who's our piano whiz. You get a month of interventional spine, a month of pediatric consults with Dr. Landry, the program director, and a month of consults at South Shore, and then a full month to do research to get exposure to that, whether you're completely new to it or very experienced. There's plenty of opportunities either way. It's guided by one of our directors of research here, and it's hand holding if you need it, and it's not if you don't. PGY 3 year. As you can see, there's more opportunities to learn about EMGs, a month of sports medicine. There's also a 1 month in-house selective rotation and a 1 month away elective, which we'll see if we get back to that this year with COVID. And again, that opportunity in your fourth year.
Okay, so regarding the call schedule, it's a generally equal call schedule. The call shifts are we tried to divide evenly amongst all the class years so that the PGY 2s aren't completely inundated with all the call shifts. It says Q12, but that's about on average, give or take a couple of days. But generally, you're not on call on when you're on electives because you most likely you're auditioning for a fellowship or something, and you're also not on call when I'm blanking out here, but yeah, I'll probably remember it later. But basically, what's that?
Just the elective.
Yeah, just electives. Yeah. But it's good because you're not swamped with call shifts as soon as you become a second year. But it is tiered. We try our best to make sure that the PGY 2s we do the Saturday calls. The PGY 3s we do the Sunday calls. So you get a Monday post call, and then the PGY 4s typically don't have weekend calls. So there is some perks from leveling up. We have a 24-hour post call day policy. It's and regarding the weekend, there's also moonlighting opportunity during your second half of PGY 2 year, where you can make extra side money by basically acting as a second resident during the weekend shift. So it helps you make some money for your pockets, but it can also help. Most importantly, the on-call resident to take the load off, to help with admissions, help with fielding the phone calls if there's anything. So that's one of the perks that was started last year, and I personally think it's amazing.
I agree, Colin. Our program is generally very, very responsive to resident suggested changes. So we're very lucky in that regard. This photo was taken here at the end of last year during one of our grand round sessions. For didactics and academics, we have protected time as all programs do. Ours is on Wednesday mornings, 4 hours once a week. During inpatient rehab rotations, we also have twice a week lunch and learn sessions where lunch is provided. We often have these hands-on sessions with the physical therapist, the occupational therapist. We've had radiologists come in and review our imaging of our patients with us. So those are very personal, because there's usually only about 4 residents and inpatient at a time. The structure it's all set up according to what's relevant for boards and learning hands-on skills. We practice with our ultrasound, we learn EMGs with hands-on with supervision from our attendings. We have Botox sessions as well. We have presentations from faculty in PM&R, but also radiology, neurology. We have orthotists who come in. We've gone to a hanger clinic, which is one of the—
You have 5 minutes.
So I'm going to move this along. We also have a multidisciplinary spine conference, which is a unique opportunity where residents have an opportunity to present with an attending to orthopedic surgeons, as well as neurologists and radiologists. We have Journal Club. We do a narrative medicine session with Dr. Stein, our chairman. And we have also developed a continuity home visit program with him, which I'm sure Colin would love to talk to you more about if he has a chance when we finish up this presentation here.
Okay, and once again, this is Dr. Bloom. She's our director of research. She is basically our point person in terms of like trying to get IRB approval, get a project started, and she and Dr. Landry are going to be the two people you're going to be reaching out to during your research rotation, which is a fairly new rotation that started last year. And basically, she'll help you come over a project, and you can reach out to specific attending in that specialty to come over a project together. We have the weekly journal clubs. We present on national conferences. And we also have a PM&R and Northwell Academic Day. Let's see, we have QI projects. And a couple of our residents were co-authors in book chapters.
And, the national presence that, Dr. Stein has, he encourages that for us as well. Amy Park, who's one of our chiefs right now, is the chairperson of the Resident Fellow Council for AAP. I'm involved with AOC PM&R. Our other chief resident was involved with AOC PM&R as well. So it's highly encouraged. We have allotted conference days if you're presenting, if you're a PGY4, that does not eat into your vacation time. Also, you can get a stipend to attend the conference if you're presenting as well.
And just to quickly go over, if you're interested in a brain injury fellowship, we do have a accredited brain injury fellowship that's led by Dr. Sabini. Current fellow right now is Dr. Mina Gayed, but our previous fellow is Dr. Komal Patel and Lindsay Thadadil. You'll be rotating in the inpatient brain injury unit. You'll be doing trauma consults in South Shore.
You have 2 minutes.
Spasticity managed research and multidisciplinary electives are also available.
Yeah, it's nice working with the fellows because you do get that added component as well as you're attending. Our residents are a mix of DOs and MDs. I know it's an important question people ask. It's about half and half. A lot of us have New York connections. We're born here, went to college here, went to med school here. But one of our chiefs is originally from Florida. 3 of us went to medical school in Florida. Last year, our PGY4s were from Pennsylvania and California. Where we live, that's another question we get. These are some of the locations that our residents live in. You can review this on your own. We'll make this PowerPoint shareable. We get together frequently. We love hanging out with each other. Here's some pictures. Because of COVID, my poor class didn't get together that often because of that situation, but we've made a point to get together as often as possible without our co-residents, without our PGY4 and PGY2s as well. We did an escape room last month. We've had a pool party. This is just in the past 2 months. We've had a pool party. We went out to dinner. Another group went out for playing video games. We're going to a barbecue on Saturday. We like each other. The camaraderie and the spirit is great. And I think that's very important in residency.
Yeah, and you can see that we were matched in like a bunch of different fellowships. Seems to be heavily leaning towards pain, but definitely in SCI, TBI, PEDS, sports med, palliative care, cancer rehab.
You can do all this on your own free time. We have a lot of benefits as well. These are mostly like coming up through residents asking for them. We have our question bank is paid for. We get the PM&R Pocket PD. Dr. Schatz is our former PD. He wrote the book. That's courtesy of him. We have a board review course. We have an academic allowance. We have a very competitive salary, one of the highest in the nation. 20 vacation days. We also get quarterly wellness days and sick days as needed. And there's some information about how we all went through COVID. This didn't affect my class as much. We weren't really redeployed, but the current PGY4s were.
That's all the time you guys had.
And just the last slide here. If you have any questions, here's our contact information. Please feel free to reach out to us.
Thank you very much, guys, for your presentation. Appreciate you joining us today. And thanks for your presentation.